Okay, so welcome. This is our second of a new live webinar series hosted by Doctors for Nutrition. We'll still be holding our CPD approved Food Vitals webinars, but we aim to bring you more of these frequent, interesting and relevant conversations with experts in different fields relating to whole food plant-based nutrition and lifestyle medicine. So I'd like to start by acknowledging the traditional owners of country throughout Australia and their continuing connection to land, waters and culture. I'm meeting with you today from the traditional country of the Kaurna people of the Adelaide Plains, South Australia. We pay our respects to their elders past and present. We extend that respect to Aboriginal and Torres Strait Islander people here today, and also traditional owners of the land in which you are joining us from, whichever part of the world you may live in. My name is Rebecca Stonor and I am the social media and events lead for Doctors for Nutrition, and I'll be your host today. So as you know, Doctors for Nutrition is an Australian health promotion charity working for a future where whole food plant-based nutrition is widely used in disease prevention, management and even reversal. Our live webinars are one way that we provide educational resources to not only healthcare professionals but also the general community. So the topic of today's webinar is what is lifestyle medicine, and we're delighted to have a panel of experts in this field joining us today. But before we hear from our speakers, I just got one quick announcement for you. If you are in New Zealand and would like a short holiday or know someone in New Zealand who might be interested, we're really excited to be holding a Dine with a Doc dinner in Auckland on Tuesday, 11th of June. We'll be hosting a panel discussion with local GPs and sustainability experts on inspiring sustainable change. It's going to be very informative and enlightening discussion. We'll then sit down to a delicious, healthy, plant-based Thai-inspired dinner created just for us by the chefs at Kuku Eatery. So if you're interested or know somebody who might be, tickets are limited, so please grab one before they sell out. My co-host Louisa will be sharing the link in the chat box. Now, if you love what we do and like to support us, there are a few ways you can do this. You can buy a DFN merchandise on our online store. We have new women's and unisex t-shirts in a variety of sizes and colours, caps, bags, aprons, and lots of other things. I'm wearing the unisex t-shirt today. I don't know if you can see the logo here, and there's a big logo on the back. Yeah, they're really nice quality and really comfortable. So check it out and start wearing our merchandise to promote Doctors for Nutrition and show your support. Now, if you can stay to the end of the webinar for further announcements, we'll be sharing some more exciting news of what we're up to. You will not want to miss out on that. Now, I've just got some housekeeping tips to get the most out of this webinar. Firstly, we welcome you to open the chat box via the Zoom toolbar and introduce yourself. Let us know your name, your occupation and location. Make sure to select the send your message to everyone so that everyone can view your messages. So for the best view, you can select speaker view in the top right-hand corner of the Zoom window. Now, after our panel discussion today, our speakers will be answering your questions live. To submit a question, you can use the Q&A option at the bottom of your screen and type your question at any time during the webinar. We'll aim to get through as many of the questions as we possibly can. So, in partnership with the International Board of Lifestyle Medicine, Doctors for Nutrition is excited to offer the certification pathway for physicians and healthcare professionals in Australia, New Zealand, and the Pacific Islands to become an IBLM diplomat. Extending beyond the adoption of whole food plant-based eating pattern, Doctors for Nutrition also acknowledges the importance of the remaining 5 pillars of lifestyle medicine, which we'll cover off during this webinar. These pillars play a crucial role in the effective prevention management of chronic disease. The alignment between IBLM and Doctors for Nutrition reflects a shared vision of creating a world free from preventable disease, which is our little tagline on our t-shirts, enabling everyone to thrive and live to their full potential. Today's webinar will give you an insight into what the certification process entails, what it means to practice lifestyle medicine, and what the benefits of becoming certified as a medical practitioner. The GPs on the panel today will also give you an insight into what benefits they see for themselves and their patients. So I'll now introduce our speakers. We are grateful to have Stephan Herzog on the panel, joining us all the way from the US. Stephan is a business professional who was born and raised in Switzerland and spent most of his professional career working for large multinationals in Australia, Europe, and the US. He established the American and international boards of lifestyle medicine, helping to bring standardized lifestyle medicine certification to all corners of the globe. Stephan is passionate about being a walking, talking example of optimal health and motivating others to be the best they can be. Now, Dr. Catherine Gray has practiced in Hastings, New Zealand as a general practitioner for 20 years. She is passionate about preventative medicine and improving health outcomes for the patients through environmental and lifestyle choices. Supporting workplaces as a means of optimizing health and well-being is an exciting new development she uses to impact many people and healthy lifestyle change. Catherine obtained a medical degree from Auckland Medical School and is a fellow of the Royal New Zealand College of General Practitioners. She is board certified lifestyle medicine physician through the International Board of Lifestyle Medicine. Catherine also has postgraduate qualifications in occupational medicine and is a clinical senior lecturer in occupational medicine at Otago University. Now, Dr. Sam Gartland is a GP who did his training at Manchester University in the UK. He enjoys all aspects of general practice with special interest in nutrition, lifestyle medicine, multiple sclerosis, and has additional training in skin cancer and recently completed a master's in sports medicine. In 2008, he was diagnosed with multiple sclerosis and was fortunate at this time to find the life-saving knowledge and guidance from Professor George Jelinek and the Gawler Foundation, where the importance of lifestyle interventions became very clear to him. These insights informed his recovery and his practice as a medical professional. He believes in practicing lifestyle medicine with his patients, and he'll be launching a clinic, which we can talk about later, in New South Wales later this year. So on behalf of Doctors for Nutrition and our viewers, welcome to you all, and thank you so much for taking the time to discuss this important topic with us today. Now, Stephan, would you like to kick off the webinar by sharing your slides, please?
I would love to, and thank you very much for having me. And make sure here that works. Give me 2 seconds.
Yep.
Okay. Good. Can everybody see that?
Yes, it's there now.
Okay, we're off and running then. Okay, we should talk about a little bit about the lifestyle medicine framework globally. Some of the things that I'm going to talk to you about, you already know, and so just bear with me. Our manifesto, and I think it's really important that we talk about this, is that we are committed to the highest levels of evidence in lifestyle medicine, and that becomes important in a minute. We obviously want to have global standards across international laws and cultures and borders. We want to make sure that we're not just blue-eyed and thinking that we can change the world without actually having financial models underpinning all this. And we want to innovate enough so that we can continue to keep track with how non-communicable diseases develop. When you look at the framework, there's so many ideologies out there, you know, from social justice to climate change. People are into plant-based nutrition through animal rights. Natural medicines is particularly important in places like India and obviously China, and then veganism. And there is also, you know, the whole idea of religion, you know, again, in India, Hindu is very much, but we don't actually care where people come from. There is benefits to all of this downstream. If we do the right thing by ourselves for human health, then the planet and the animals and everybody else will benefit too. So what we're committed to is human health in the house of medicine, that we're evidence-based and physician-led, because whether we like it or not, the medical industry is still a top-down physician-led industry. And so in order for us to get credibility, we need to maintain that. When we look at what people get tested on, what's the lifestyle medicine framework, here is basically the key slide that explains what we teach and what people get tested on. And the percentages behind this, how many questions in the exam are based on these topics. They're on the website, so I don't want to spend too much time on this. Every topic has got a subset of then stratified individual key points that are all spelled out. So you see emotional and mental health and well-being. These are kind of the detail that we go into. When it comes to the landscape, so until last year, we had one happy family, we had one certification exam, we still only have one certification exam, but Britain decided to do a Brexit, not just politically, but also in terms of wanting to have their own thing in lifestyle medicine. And so they created an accreditation that is evidence-informed. They deliberately moved away from evidence-based to evidence-informed, so keto, paleo, and other practices could be included. The challenge we have with that is obviously that we say we follow the evidence wherever it leads. We want to be peer-reviewed, and we want to have third-party checks and balances. In other words, IBLM as the certification body doesn't actually create educational material. We review educational material to make sure that it teaches what people get tested on, but we don't create it ourselves. And the CME are always issued by a third-party independent university or a CME body. And so at the moment, we have this two-based approach. So you can see that the Australian Society of Lifestyle Medicine decided to move with the Brits and with the Polish Society to move with the national accreditation. And so Australia is actually just basically rebranded the British accreditation and calls it now the Australian accreditation. Nothing wrong with that. We stick to the plant-based, whole foods, evidence-based, physician-led framework. But that's kind of the difference between the two. Accreditation is you do 60 hours of CME, you do a 1,500 word essay, which again, with the advent of ChatGPT, I'm not sure that's all that valuable, and then you become accredited. IBLM is a proctored bona fide exam where you really have to know your stuff in order to pass the exam. We talked about the lifestyle medicine competencies. The owner of the global lifestyle medicine competencies actually is the Lifestyle Medicine Global Alliance, with the association of all the lifestyle medicine societies around the world. And now Doctors for Nutrition, Doctors for Nutrition is also now a member of the LMGA. And you can see item writers currently for the current exam come from all over the world. And then we have educational program writers. Again, there is many countries who have written their own content based on obviously the lifestyle medicine competencies, and those all are approved study guides to then prepare for the exam. When we talk about the whole idea of prevention, arrest, and reversal, so here is the thing that you probably already know, but I just want to quickly canvas it. The communicable disease model we're all familiar with. Unfortunately, the non-communicable disease model is exactly the same. And that's the challenge we have today, that we don't provide prevention, we don't provide arrest, and we don't provide any reversal of the current chronic disease conditions in the general way we treat patients today. So we're managing an illness rather than restoring health. And the challenge with disease prevention is that everybody knows what to do, but we simply don't do what we know. And so knowledge is not what matters. The other thing, and that's a quote from actually Dr. Darren Morton, who is an Aussie, he says, people don't change current behavior to prevent future disease. People only ever change behavior to prevent current disease. So I smoke because my auntie smoked till she was 95, until I get diagnosed with lung cancer, and then I might consider stopping. That's kind of the mindset we have when it comes to prevention. The issue with arrest is that addiction is alive and well, and we all are somewhere on an addiction scale, right? We all have a susceptibility to addiction. Some people stronger, some people less strong, but it's very difficult to do moderate, right? For most people, it's either I do or I don't. And particularly when it comes to disease, so is a moderate amputation better than, when you have gangrene or you have macular degeneration? Is a moderate macular degeneration better than a heavy one? So the whole idea of moderation is just really, it's a challenge. Lastly, when it comes to the chronic disease reversal, we need to recognize that there is a dose response to lifestyle medicine. It's wonderful if you go to meatless Mondays, but if you do bacon and eggs for breakfast, the ham sandwich for lunch, and the roast for dinner, the other 6 days a week, then you might not get all that much benefit from a meatless Monday. So again, there is a dose response. There is also the other thing that we fight constantly against is this mindset of when you say to people, I'm predominantly plant-based. Oh, really? What can't you eat? And so it's all this mindset of deprivation. These are all the things I can't do anymore. And we got to move away from that, because I love being plant-based and I eat an incredible variety of foods and I rejoice in my food and I try to present it wonderfully, make it taste wonderfully. So we have to change the mindset with people. My favorite slide, a lot of people say, so where does the whole functional integrative medicine fall into the whole scheme of things? And so we say that obviously at med school, you learn about prescriptions and surgery. That's kind of what physicians do at med school. Then below that, there is this idea of a more natural therapies that functional and integrative medicine promote. A lot of it is, and I don't mean to be disrespectful to people who practice integrative medicine, but if we replace is the pharmaceutical against the nutraceutical, then we really haven't done our jobs just quite yet. So again, we feel that lifestyle medicine is actually the basis of everything. And the further down the pyramid you come, the more natural the intervention and the more low cost and the more low risk it becomes. So what we're not trying to be is a new medical discipline. We simply want to be the basis of a new foundation for every medical discipline that currently exists. The International Board of Lifestyle Medicine, takes two approaches. There's obviously a lot of physicians and allied health professionals who already have done their degrees, they're practicing. So we weren't wanting to retrofit those people and give them the knowledge about the whole lifestyle medicine treatment modalities that they didn't learn at med school or nursing school or whatnot. And then we obviously work with medical schools, with nursing schools all around the world to introduce the lifestyle medicine into the curriculum. So hopefully within 10, 15, maybe 20 years, we're absolutely made ourselves obsolete. What we do is now the common standard around the world. I'm obviously not too hopeful because, when you look at smoking, there is still 19% of the population that smokes. So there is still a lot of need to talk about the adverse health effects of smoking. Why would you want to get certified? So obviously it gives you a high level of expertise. And I'm going to jump through this. It sets you apart. There's a lot of people who say, oh, I know this. And they regurgitate what came down in the latest social media blog. Right. And so again, today it's keto, tomorrow it's paleo, the day after I can lose weight with Ozempic. And what makes you the expert? Oh, I'm glad you asked. I actually learned this and I got certified in this. So I know what I'm talking about. I'm not just regurgitating a blog that I read this morning. The lifestyle medicine framework creates a common language for everybody across the globe, and it creates this global community. There is no other medical specialty around the globe, whether it be endocrinology or cardiology or whatever, that has a single global certification exam. Everybody decides, oh, no, we're different. If you get certified in the UK, you cannot possibly practice in Australia unless you jump through the Australian hoops. And if you practice in Australia, you cannot possibly practice in the US because the US is different. We have to make you jump through hoops in the US. So lifestyle medicine, our certification is the first global certification. We obviously address the underlying cause of disease. We're not just looking at the symptoms. A lot of physicians say, since I practice lifestyle medicine, I start to enjoy my job again. I actually feel that I can make a difference. Not everybody you tell about lifestyle medicine interventions will say, oh, where have you been all my life? Why haven't you told me this before? Because behavior change is hard. But being able to offer, would you like the knife or would you like the fork? Right? I could teach you how not to use metformin if you wanted to know what you could change in your lifestyle. So restoring health becomes more and more important, particularly when the financial models are starting to go out of kilter. Obviously, you're all familiar in the US how medical utilization costs are just through the roof. We're at 18% of GDP at the moment, and that's totally unsustainable. And unfortunately, the Western world is not far behind. And although we think Medicare is a universal thing, well, I've been treated by Medicare and it wasn't an enjoyable thing. The waiting lists are horrendous. And again, we're just treated with conventional medicine. And lastly, at least for me, being active in the lifestyle medicine arena actually forces me to practice what I preach. I would be a hypocrite if I came and talked to you about this and I wouldn't practice this every day myself. And a lot of physicians say, you know what, this actually keeps me honest. How to get certified? Okay, this is the slide. So we have physician certification and we have doctorate or master's level health professional certification. Education is open to anybody. And there is no law that prevents you from telling people that a good night's sleep, broccoli and beans are good lifestyle choices. You do not need certification for that. However, if you work in the medical field, then obviously we want to make sure that the people who have doctorates and masters also then have accurate or certification in lifestyle medicine. There is 4 prerequisites for physicians. You obviously got to be a licensed physician in the country of your residence. We need 30 hours of CME from an approved course. And again, there is various to choose from. We need 20 hours of CME from an approved event. And again, you can attend virtually or in person. And we need a case study. And the case study is simply tell us about a time when you used a lifestyle medicine intervention, either on yourself, on one of somebody in your family, or one of your patients. What happened? What is pre and post? It can be as benign as sleep. I couldn't sleep, so I turned the thermostat down, made it cool, made it dark. I stopped using blue screens 2 or 3 hours before. I made sure I was hydrated. All of those things that we teach about sleep hygiene. And that's good enough. We're not expecting War and Peace or some, high caliber case study, so to speak, that can be published. For Dr. Master level, it's exactly the same except for the case study. The exam is 150 multiple choice questions for physicians and 120 multiple choice questions for PhD and master's level health professionals. And then we have it available in a variety of languages, obviously not important for Australia and New Zealand. And then we either have the certificate issued by IBLM, and over time we also can jointly issue it. So in the US, obviously, it's the American Board of Lifestyle Medicine and the International Board. In Australia, it used to be ASLM and the International Board. Going forward, it might be One Day Doctors for Nutrition and the International Board of Lifestyle Medicine that issue the certification. But that's a bridge we're going to cross when we get to it. Quick slide on who is getting certified, just so you know, this is truly a global thing. So we have about 66, 88 physicians and PhD and master's level health professionals that have been certified. These are all the exam hubs around the world where we run regular lifestyle medicine certification exams. When you look at the numbers, obviously the US is not so important. So here is Australia and New Zealand. You can see that Australia is actually the number 3 country on earth with in terms of the amount of physicians who are and professionals who are certified in lifestyle medicine. There is the US, there is Britain, there is Australia, and then Brazil might be very close because Brazil is a huge country. But anyway, you won't be on your own. If you choose to get certified in lifestyle medicine, you join about 250 Australians and about 40-odd New Zealanders who have gone before you. So you have a tribe already to join. And this is kind of the little picture of the Global Lifestyle Medicine Alliance, all these international lifestyle medicine societies, including obviously now Doctors for Nutrition, who are part of the family. And that's all I had. Thank you.
Thank you, Stephan. That was really good. And yeah, it's nice to see how the certification process goes and that it's a simple process for people to do. And we're really, really grateful to be a part of this as well. I think our community will find this very useful for them. Now, Catherine, would you like to start sharing your slides?
Okay. Right. Hopefully everyone can see the heading slide. And
Yep.
there we go. I
Yep,
hope
that's
that takes up the
perfect.
whole screen. That's great.
Yep.
Thanks,
Yeah.
Rebecca, and thanks
No
for your
problem.
welcome and introduction. And
Yep.
yes, Stephan, thank you for your talk as well. It was jogging my memory of what I went through with IBLM, but I'll get onto that later. So yes, what is lifestyle medicine? And as the topic of the webinar is, I was introduced to this very early on, and I've always kept it in mind as well. If it's not evidence-based, it's not lifestyle medicine. So if you're not certain about a certain practice or an intervention of some sort, think, is it evidence-based? If it's not, then it won't be part of the lifestyle medicine repertoire. So a little bit about me. Rebecca's covered my background very well, but I operate in two spheres. I've come from a general practice background, and I still keep my vocational registration and do GP locums. I'm from the east coast of New Zealand. And recently I was looking for something extra, and I teamed up with a hospital specialist who's a kidney specialist, and we voiced the same frustrations, that we were at the reactionary type of model of medicine that we were practicing, and wanted to be more proactive, to be the proverbial fence at the top of the cliff and not the ambulance at the bottom, especially in kidney health. You can imagine it, that 80-90% of kidney disease is entirely preventable. And so we looked for a model to set up a private practice where people could be proactive about their health and pick up their health risk factors and help people choose a healthier path forward. And so that's how I got started in 2018. Now the problem is we were picking up a lot of health risk, and I wasn't equipped to deal with it. I had no idea. I know we pay homage to lifestyle changes, but I had no idea how to assess lifestyle or prescribe lifestyle. And so I looked around for a wellness model that we could operate with, and that was evidence-based, and you can guess what I found. Lifestyle medicine absolutely ticked all the boxes. In fact, the more I learned about lifestyle medicine, I realised I wish this was the sort of medicine that I had been taught, and it was the sort of medicine I'd wanted to practice. So fast forward, I decided to, to be credible in the space we were working in, is to get the international certification. So I passed that in 2019. I went on the following year during lockdowns. It was a good time to study, and got fellowship with the Australasian Society of Lifestyle Medicine. And then following that, and I'll talk a little bit about that journey, I've moved also into the occupational medicine space, which actually overlaps with lifestyle medicine quite incredibly, with the focus on prevention and risk management, etc., and getting to the causation and not just waiting for things to happen and deal with them then. So as far as IBLM, I was asked just to go over a little bit about what this process was for me personally studying. Now, Stephan has jogged my memory that yes, there was a case study that I had to submit, so I admitted that off the slide because I'd forgotten about that. It wasn't a difficult, obviously, because I've forgotten about it, but it was fun actually doing that and just exploring in more detail about an intervention and the impact on patient health. So for me, I remember it taking about 4 months of study, and this was the book that we used, The Foundation of Lifestyle Medicine. It was the second edition, it just come out, and I suspect it's been reviewed several times since then. And
Fourth edition now.
It's fourth edition.
Yeah.
I guess that probably would be. And Stephan has shown you essentially the outline, and that hasn't changed a lot from when I studied it. And for me, it was about 1 to 2 hours most days of study just to work through the book. Now, one of the best things, and I would recommend it for anyone who is contemplating doing the IBLM exam, is we were put into online study groups, and I think we met about fortnightly through the study period leading up to the exam. And that was incredibly inspirational, and I'm still in contact with a lot of the group members. So it was a real peer support as well, but also spurring us on and just really broadening your understanding of the topic. And it was MCQ based exam, and Stephan has reminded me it was 150 questions, so it took easily probably an hour and a half, 2 hours. So it was definitely a rigorous undertaking. So that's what IBLM was like for me. So since then, what does lifestyle medicine look like in practice? So I'm a joint owner of a private health clinic, go by the name Shape My Health, and the shape bit will come up later. And in New Zealand, there really is no funding pathway to practice lifestyle medicine. So a lot of our patients have to come self-funding, and so that of course limits who you can reach. And that was one of my frustrations, was you wanted this impact to be felt more than just individuals and couples. It was good to help individuals and couples, and they were very good at spreading the message too, by the way. But it happened accidentally because we were invited into several workplaces, big workplaces, to help them set up like wellness programs and to help improve the health of their employees. And because maybe policymakers at a government level don't realise this, but certainly employers do, that healthy employees are good for business. And so it was an incentive to, reduce sickness absences and loss of productivity due to employee poor health. So we got involved in that space, but also too, workplaces wanted us to manage all the health and safety side of it too, and do all the annual health monitoring, like lung function tests and hearing tests, etc. And that was a complete foreign area for me, so I decided to upskill in the area of occupational medicine just to fill that knowledge gap, and I've thoroughly enjoyed it and realised that a lot of the principles are very similar. So essentially in a workplace, if you can optimise the work environment so that people go to work and the default option is that they'll be healthier there, whereas they won't have access to junk food, they won't have access to any beverages but water, and they're physically very active, then for 8 hours a day by default, and hopefully they're getting 8 hours sleep a night, 2/3 of the day they're actually undergoing healthy practices without even realising it. So it was really fascinating for me to actually see that potential. So the pillars of lifestyle medicine, I mean, it varies how many pillars people say, but this is the model I put together, because when you start in lifestyle medicine practice, there's nothing out there. It's a blank template, and you generate the processes yourself. And this is what I generated, and based on the pillars of lifestyle medicine that I've been taught, a model that I use, and I find it incredibly useful. So our name is Shape My Health, so you can see I use the acronym SHAPE, and you're welcome to borrow this. And so I go through, and I've merged a couple of the pillars for ease, and so I start by assessing lifestyle by starting at the top. So ask about sleep, and sleep's a really good way to start, because nobody is threatened by asking about their sleep. And most people are very happy to tell you about their dreadful sleep that they're having. And sleep is a really sensitive indicator about the rest of their health risk factors. So it's a really safe place to start. So I start with sleep, and then happiness. So that encompasses quite a number of pillars. So look at their social connections, you look at the emotional, mental wellness, stress levels. And to be honest, most of my conversations with patients are on these first two things. And then once you have a feel for what's going on in their life, then the rest actually fall into place. And also to the patient themselves actually start understanding some of the drivers behind their health risk factors. So A is our risky substances, P, physical activity, and E is your eating pattern. So that's how I assess lifestyle, and I use the same 5 components to prescribe lifestyle as well. So for ease of time, I won't spend more time on that, but you're welcome to use that acronym if it's helpful for you. So I was asked to just describe personal impact of lifestyle medicine, because physician health is one of the components that we studied. And so early on, I adopted whole food plant-based lifestyle. I was going to try it for a month because I thought if I'm prescribing it, I need to know what it's like to do it. And I haven't stopped, to be honest. So I found it an easy transition, and personally quite beneficial. I have quite a family history of hypertension and hypercholesterolemia, and certainly with the lifestyle changes, that is kept in check. It's not perfect, but not at the level where you would need to consider medication. But other areas which I wasn't quite expecting but was quite delighted with improvement was sleep, optimizing sleep. When you're a woman, get to a certain age, sleep can be quite elusive. Whereas I found instead of having 5 or 6 bad nights in a week, it switched around very quickly. Within a few weeks of adopting lifestyle medicine practices, having 5 or 6 good nights in a week, and now it's probably 6 good nights out of 7. So yeah, really delighted with that. You feel way more human with optimal sleep. And a couple I wasn't expecting. Now, at the time before I adopted lifestyle medicine practices myself personally, I wasn't really paid much attention, but I had a niggly arm with lateral epicondylitis. I had a Achilles tendonitis, just a low grade. It wasn't causing me too much trouble. When I had a bit of patellar bursitis on my knees, was a little bit achy and swollen. And anyway, one day I realised a month or 2 down the track, it had gone. So it's quite well known that lifestyle medicine practices are anti-inflammatory, and so certainly personally I noticed that reduction in inflammation. And the more you understand about causation of disease, you realise that low-grade inflammation is actually the basis for many of our chronic disease pathology. And the last area, which I wasn't expecting, but I'm very delighted that my annual visits to the dentist no longer require extra visits for fillings and this and that I used to have. So that's been a nice bonus, and it's easy on the pocket too. So that's the impact on me personally. And I just got a couple of quick cases. So sorry, it's a busy slide, but I'll just quickly go through it. So this is one of my earlier patients. So she was 39 at the time, and I first saw her in 2020. So that was between lockdowns in New Zealand time. A whole raft of symptoms, and probably mostly related to metabolic dysfunction. And her BMI was 40, waist circumference 114 centimetres for women. You want to be under 88 centimetres. Blood pressure is fine, and she's creeping into the early diabetes, hemoglobin A1C range, cholesterol's acceptable, and her AL2 liver enzyme was just mildly raised, so certainly probably an indication of metabolic non-alcoholic fatty liver disease. So going through the SHAPE acronym with her, so in fact, yeah, our patients generally get quite a detailed questionnaire that follows this pattern. So sleep, slightly less than the ideal of 7 to 9 hours. Looked at different factors around her mind health, and she had happy, stable relationships, but she was under quite high stress operating a family business, almost active 24/7 in that. And she loved the work, but realised it was a very stressful environment. No issues, she was a non-smoker and minimal alcohol. And physical activity, of course, she's very time poor, and really wasn't doing any regular exercise. But she, at her workplace, she does have the ability to move about a lot. So she had a smartwatch, and one of her goals was to aim for start with 5,000 steps per day and build on that. And part of what the IBLM training does is help you to set realistic goals using the SMART acronym with your patients. So it's quite satisfactory when you can help them achieve. And she was, as Stephan says, there's a good dose response, and moderation often isn't the best way to get that dose response. So she was very keen to trial a whole food plant-based diet. And often what you can do is encourage people to do it for a week, or like me, do it for a month, and then see how you feel after that. So she's a busy woman. It was difficult to follow up, but we did get a Zoom follow-up 5 months later, and she was able to stay fairly committed to her goals, which was great. And her weight had already dropped about 10 kilos, and her she hadn't measured her waist circumference, but she knew she was pulling in her belt by a couple more notches. So after that, I didn't really get a chance to follow up because as I send invites out, she would have to decline or reschedule, and eventually more pandemic interruption occurred, and she contacted me earlier this year for a follow-up, and so we're now 4 years later. And but she just wanting some extra support and advice. So she's maintained 10 kilo weight loss, and she cooked me her waist circumference, and it was 10 centimeters reduced from when we first met. And her BMI now has dropped 3 points, so it's been stabilized for 3 years. She's keeping up the exercise. Her sleep, she says, is great now. And she wanted advice and help and support to resume whole food plant-based. So she was having difficulty with the teenagers. She refused to cook 2 meals, and she was the main cook of the family, and pretty much told them, you eat what I cook or you starve. And so I think eventually over time that wore them all down, but she wanted to get back onto it, and the kids are a little bit older. Just got an extra challenge and that's, I think, getting them all thinking about their health, with the 16-year-old diagnosed with insulin dependent diabetes. So so it was really just encouraging her to adopt what she knew worked and is still working. And we got some repeat bloods done, and you can see from the hemoglobin A1C. Now I'm not sure if everyone's familiar with the units, but under 40 is considered non-diabetic. So she's now moved out of the early diabetic range to non-diabetic. So cholesterol similar. Really delighted with this. Her liver enzyme has now dropped into the non-inflamed range, so non-hepatitis, and so showing that her metabolic factors are all reversing. So we're going to try and follow up in a couple of months. So that's kind of the patient that I see one-to-one, or in a couple, see them together. So example of what workplace wellbeing can be. I'll just whip through these 3 employees who examples from late last year with a blue-collar company that we do annual health monitoring for. And this company is particularly proactive, and as well as doing the hearing tests and their lung functions and vision testing, etc., they want us to look at wellness. We screen them for mental health, and we have a finger prick point of care testing for cholesterol and glucose. So to look at the cardiovascular, and we do cardiovascular risk assessments on them. So when the nursing roster is a wee bit short, I often jump in and meet the employees one-on-one, which I enjoy. And so these are just 3 cases, and that I was directly involved in. So employee number 1, so did his finger prick test, said, oh, blood sugar's normal, that's great. And he surprised me by saying, well, it wasn't last year. And then he surprised me and said, you told me to stop eating rice. I thought, oh, okay, that doesn't sound like my usual advice. And so anyway, the story goes, and I look back to the advice and what was recorded, and my usual is to start with the junk food and highly processed foods. And no, he wasn't actually eating that. He wasn't having any sugar sweetened beverages. And then realised, because of his cultural background, he was having a lot of refined carbs, i.e. white rice. So I had told him to stop eating white rice, and I told him where to go and find brown rice and other whole rices, and he did, and he had swapped to brown rice, and that had normalised his blood sugar. So I'll just mention here, when I said unenrolled with primary care, that means that these employees, they are immigrant workers, and they actually don't have any primary health care provider. So if we weren't there providing assessments, nobody's looking after their health, essentially. And I guess they'll be waiting for the ambulance at the bottom of the cliff. So employee number 2, so his result was mildly raised, his blood sugar. So in between, not diabetic range. But he said last year it was in the diabetic range. He said, I'm only drinking water now. So I'd obviously given him the message to take the sugar out of your coffee and to avoid your Coke. And employee number 3 was a really rewarding one. It was the 3rd year we'd seen him. His blood sugars, his blood sugars, was rising each year. So 13 as well in the diabetic range, then 20, and then this year it was 29. And you try to talk to him about it, and he just thinks it's all a great joke. So I actually had to go home and think about him, because at 29, you're worried about his risk at work, cognitive impact of sugar that high, visual disturbances, and as a forklift driver, it's going to be a problem. So I actually asked the staff to get him back, and I thought, I'm going to have to break confidentiality and tell his employer that he's actually a risk at work. So anyway, he did come back 5 days later, and so I was having to explain this to him, and he surprised me by saying, well, actually, he's obviously thought about it too. I've stopped drinking Coke, and I'm not having 3 teaspoons of sugar in my coffee. In fact, I'm only drinking water. And I was quite astounded. So I repeated his blood sugar, and it was 18, which is still diabetic, but in 5 days it's dropped, over 10 points. And if he keeps it up, then he has the potential to completely reverse diabetes and obviously function a lot better. And so that meant I didn't need to disclose his health condition to his employer, but I did give him a warning to keep it up, otherwise he'd be crashing his forklift, and that would impact on his job and his potential future employment. So just to give you an idea of how workplaces, you can really have quite significant impact to a wide range of individuals. So thank you.
Excellent. Thank you, Catherine. That's great. That's it's really good to see your experience with the certification process, and also how you're applying it in practice as well. Now, Sam, you are next on the list. Are you able to share your slides?
Yeah, here we go. Share. Right, I'm on. That's not the right one. Okay. Okay, is that good?
Yep, perfect. Thank you.
Okay, well, thank you, Catherine. Thank you, Stephan, and thank you to Doctors for Nutrition for putting this on, because this is an absolutely crucial thing that you're doing. We have to spread this message because it saves people's lives, it reduces suffering for everybody, and I know that most people here will have personal experience or a close relative who have been affected by serious chronic diseases. And if we're going to successfully manage these, then we actually have to deal with the underlying causes. So my name's Sam Gartland. I'm a GP in Northern New South Wales. My background was initially as a critical care doctor in the UK. I got very sick when I was 32. I was diagnosed with multiple sclerosis. I had a fairly aggressive course early on in the disease with 3 relapses in 12 months. I was given retirement due to ill health from the National Health Service in the UK. The treatment that I was offered at the time was an injectable medication. There were 2 choices, Copaxone or interferon, which were slightly beneficial. And I was sent home and told to come back when I got sicker and to treat a relapse. And I'm very grateful that at that time, George Jelinek had begun his work initially with a book called Taking Control of MS. And I'll come on to that during this talk. But he recognized that this was a modern disease, largely due to lifestyle factors. And if you want to successfully manage this condition, you have to treat the underlying causes. And so that's obviously had a profound effect on my understanding of health and how I approach the management of Western modern chronic conditions. I've got a website which will be updated shortly, and I'm opening up a lifestyle medicine clinic in the next few months. So if anybody's interested, please get in touch. So the pillars of lifestyle medicine, these have already been mentioned, but just to reiterate, the cornerstone for this really has to be whole food, plant-based nutrition. There's just an abundance of evidence now that for optimal health and for recovery from these modern chronic conditions, the adoption of a whole food, plant-based diet is essential. And if you look at the disease reversal studies, whether it be heart disease, diabetes, the arresting the progression of prostate cancer, if you want to treat these successfully, you adopt this fully. And certainly in the Overcoming MS program, the people who do well are the people who do this all or nothing. You take this on and you're going to give yourself the best chance of being well. So alongside that, the importance of physical activity and a combination of aerobic exercise, resistance exercise, HIIT training, those are all going to optimize outcomes for people with illnesses. We can't avoid stress, but how we manage stress is crucial. So stresses can be helpful for us if they promote good behaviors, if they promote good responses. But chronic unresolved stress is inflammatory for the body and results in poorer health outcomes. And there's some really great studies on that. One of my favorite ones is a randomized controlled trial from the 90s in the Journal of the American Medical Association, where they took people with asthma and rheumatoid arthritis, and they got some people to simply journal about their life's most difficult experience. And for the asthmatics, it improved lung function by over 10% at 4 months. And for people with rheumatoid arthritis, it dropped disease activity by around 30% at 4 months. And this was just a single intervention of expressing difficult emotions. So if you had a drug that was doing that, obviously everyone would be on it. The other pillars, the avoidance of harmful substances. So clearly smoking, alcohol and other substances are not going to be beneficial for your health. Catherine's mentioned the importance of restorative sleep, and that's obviously crucial. We know that shift workers are much more prone to autoimmune disease, much more prone to cancers. And there's also a bidirectional relationship with other sleep disorders. So we know that things like sleep apnea, sleep disordered breathing can be as a result of lifestyle diseases. And again, if we're going to successfully treat them, ensuring that those, if they are present, that they're treated, they'll lead to better outcomes. And then, of course, the importance of social connection. So if we're making lifestyle changes, then we need to be surrounded by people who are going to support us in those changes. And that's why it's wonderful to have Doctors for Nutrition, the International Board of Lifestyle Medicine, people who really understand this stuff and support people in that process. That's essential for people to do well. But then also connections in our community. And there's a very famous study from the UK, the Froome study, where simply supporting people in their communities resulted in big drops in inappropriate attendances to emergency departments and avoided these emergency admissions, such that I think they dropped in Froome their emergency presentations by 30%, when everywhere else in the county in Somerset, their emergency presentations were going through the roof. So it has a profound benefit for the individual, for the society as a whole. So I've chosen to talk about multiple sclerosis because I think it's an excellent example of a disease that responds very well to lifestyle measures. And obviously it's something that's affected me personally. So just to remind everybody, multiple sclerosis is an autoimmune inflammatory condition that affects the brain and spinal cord. It's considered progressive. The current paradigm, I think it's fair to say, would be that it's incurable. And it's the commonest disabling illness of young adults globally. The data around this is fairly alarming. The prevalence of multiple sclerosis, recent data showed that this increased in Australia by around 30% in the last 10 years. And so when you have a disease that's increasing in frequency like that, you know it's not due to genetic factors. This is due to lifestyle factors. So I'm just going to have to move my... and then if we look at studies from twins, we know that your risk of developing MS is around 25% genetic, but everything else is due to external factors. The course of the disease is basically entirely due to external factors. Now, there's a small study of about 127 people I know that study well, 127 people, a small Australian study showed that genes would have a slight bearing on the early course of the disease in the first 5 years. But the really large genetic studies looking at thousands of people very clearly show that the genetics have no bearing on the course of the disease. And I chose this study because this was the largest one, the International MS Genetics Consortium study. And they looked at nearly 10,000 people with multiple sclerosis, and they very clearly stated that there was no evidence for genetic associations with clinical course, severity of disease, month of birth, and no evidence of interaction with gender. So common to all this explosion in autoimmune inflammatory conditions, this isn't due to genetics, this is due to external factors. And we've got very good data that tells us what those factors are. Okay, so the risk factors at the top here, the most important, a Western diet high in saturated fats, high in altered fats, hydrogenated fats, trans fats, and low in omega-3s is one of the main risk factors for the development of multiple sclerosis. Cow's milk exposure, in fact, any animal milk exposure is an issue. And it's not just due to the saturated fat content, though that is an issue, but there's a very clear evidence of a molecular mimicry issue. So we know that the immune system responds to external antibodies, and it just so happens that the proteins in animal milk resemble the proteins on the myelin sheath, the part of the nerve that insulates the neuron that allows for fast conduction in the nerves. And if people are exposed to cow's milk proteins and they have MS, they produce antibodies against the myelin sheath, and you get this direct molecular mimicry issue where the body starts attacking itself. And there's good evidence from animal studies, basic science studies, studies in humans with MS, that when people with MS are exposed to these cow's milk proteins, it stimulates an autoimmune reaction. You throw off all the cytokines, you get in a relapse. In the animal models, if they're sensitized to cow's milk proteins, you expose them to milk, they become paralyzed. One risk factor that you can't avoid is your exposure to viral infections. And so Epstein-Barr virus is the most commonly, most strongly implicated virus in multiple sclerosis. The human herpes virus is also too, but my understanding of this would be that you have this pro-inflammatory milieu in the body, and it just takes like a trigger to the immune system to set off some inflammation, and that often triggers the development of the autoimmune condition, in this case multiple sclerosis. Smoking is strongly implicated in the development of multiple sclerosis, and once people have MS, if you smoke, you'll have a much faster progression, you'll get more lesion burden, you become much more disabled much more quickly, and we do have evidence that if people stop smoking, then that slows that down. We've mentioned the importance of stress in the management of lifestyle medicines conditions, and MS is an absolute classic for this. So there's very clear evidence that if people have stressful life events, exposed to trauma, and about 6 weeks later, they're much more likely to have a relapse. And we've got very good data, and I'll come on to this later in the talk, that if people develop helpful and constructive coping strategies for stress, then they can do a lot better. And we can see these changes on MRI scans. And then, of course, coming back to the importance of sleep. So we know that shift work is strongly implicated in the development of MS. I know a lot of the doctors who are involved in overcoming MS have all been working in acute specialties. So we've all been doing these shift works, which aren't good for our body. And then I've mentioned before the issue of disturbed sleep. So sleep disorders, sleep disordered breathing, obstructive sleep apnea, very closely linked with MS. And for some reason, people with MS seem to have these collapsible airways and much more prone to sleep apnea, and that would lead to inflammation in the body. And then if we treat that, obviously that can improve the MS, reduce the inflammation, improve the immune function, and improve symptoms like fatigue. Now, this data isn't new, and this is a picture of Roy Laver-Swank. And Roy Laver-Swank, back in the 1940s, was an eminent neurologist. He taught at Harvard and McGill. He later became professor of neurology at Oregon University. And in the 1940s, he went and worked over in Scandinavia. And he very clearly showed that countries that consumed large amounts of saturated fat were much more prone to developing multiple sclerosis. But within those countries, and this was in Scandinavia, coastal communities that consumed large amounts of omega-3s had a reduced risk of MS. And so that sort of piqued his interest, and he followed that up. So there were basic science studies, animal studies at the time. If they fed animals high saturated fat meals, they developed MS-like lesions in their brain. And he put this all together, and this was the trigger for him to do an absolutely extraordinary study. So if I just show that here. So in 1948, he'd recognized the importance of fats in the development and progression of multiple sclerosis. And so in 1948, he began this study. It was initially with 150 patients. There were a few dropouts. And he divided the group up into two groups: good dieters who were consuming less than 20 grams of saturated fat per day, and poor dieters who were above that. It's important to note that this was the gold standard study of its day. It was a prospective cohort study. This type of study was the study that won Minot the Nobel Prize for the treatment of pernicious anemia. It's just a historical curiosity that, because Swank published so late in 1990, that this wasn't the standard treatment. If he'd published earlier, he could have well been like Minot and won the Nobel Prize for his work. This would have been established. We wouldn't even be having this conversation. But by the time he published in 1990, a randomized controlled trial was the standard of proof required to prove something. And so its great strength also proved to be its greatest weakness. But to go through the data, oh yeah, and I should also point out that in his study, coming back to the all or nothing approach to the diet, the average saturated fat content at that time in the Western diet, in the American diet, was around 150 grams of saturated fat per day. So even in the poor dieters group, people were making significant change, but it wasn't enough, certainly not on the level that you'd achieve with a whole food plant-based diet. So coming back to the paper, he followed these people up for 34 years. They were assessed by neurologists in the clinic, and the results were simply stunning. So this first graph is a graph looking at relapse rates per year and time before being on the diet and then being on the diet. And we can see here that before people go on the diet, they were averaging around 1 relapse per year. Within a year of going on the diet, their relapse rates dropped by 80%, and they achieved significant stabilization around the 5-year mark. So it can take up to 5 years for the full effects of the lifestyle change to really take effect. I'd like to point out that this has been replicated. There was a small randomized controlled trial performed by Bianca Weinstock-Gutman's group in the States, and they took people with MS, randomized them into 2 groups, and putting people on a low-fat diet reduced relapse rates by 80% within the first year. So very good data that the manipulation of fats in the diet has a significant effect on the progression of MS. But relapses are just one part of MS. They're like the tip of the iceberg. What's really going on is degeneration and progressive MS, progressive disability, and that's what really matters to patients. So I'm sorry about the wavy lines on this. I photocopied this from the Overcoming MS Handbook. And this is a graph looking at disability progression over a 34-year period. So that's 34 years along the x-axis. And then we've got disability grade up here on the y. 0 is no disability, 6 is dead, 1 is very mildly impaired, just picking up neurological signs on a neurological examination. 3 would be ambulant but with a stick, 4 would be in a wheelchair, 5 is bedbound. And so we can first look at people with mild disability, and these people start off with mild disability, they're on with a solid line. And we see that for the top line, these are people who restrict their saturated fat to 20 grams or less per day. And their situation is very reassuring. They stabilize, they have no progression in disability, and all of them survive the 34 years to the end of the study. Whereas if we look at the poor dieters, again, this is the people with mild disability, the poor dieters have made significant change from a standard American diet, but they haven't restricted enough, and their outcome's absolutely disastrous. They have massive progression of disease and 78% dead at the end of the 34-year study. Now, is it just mildly affected people are affected or benefit from lifestyle change in MS? No. We look at people here with more significant disease, starting off with a disability grade of 3. And again, they make the lifestyle change, 21 grams of fat per day or less, they stabilize, no progression in disease, and they all survive. And then again, we compare that to the people who aren't able to make the significant lifestyle change. And again, an absolutely awful picture. Massive progression in the relapsing, in the disease progression of multiple sclerosis, and 91% dead at the end of the 34-year study. Very, very convincing data there. There's a lot of reasons why more wasn't made of this study, and we can talk about that afterwards. But fortunately, this was picked up by one person, and this is Professor George Jelinek. And I'm very grateful for George. He saved my life. I know he saved many other people's lives. And he had great insight into what was going on. And it's an absolutely fascinating story. And for those people who aren't aware of it, I'll just summarize it briefly. So George's mother actually was affected by multiple sclerosis and killed herself, suicided when he was a junior doctor because of the effects of the disease. George went on to become the first professor of emergency medicine in Australia, and he was the editor of the Emergency Medical Journal. Now, unfortunately, when he was age 45, he too himself was diagnosed with multiple sclerosis. But being an academic doctor, he went back to the literature and made the same conclusion that Swank did, that this disease was increasing in incidence and prevalence. It was a modern disease, and it would be due to lifestyle factors. And in 1999, he put together the Taking Control of Multiple Sclerosis program. And this was initially just a list he placed up on his fridge, adopting a whole food plant-based diet. And to be straightforward, the Overcoming MS program can include fish that can be pescatarian if you wish it. Cutting out dairy for the reasons I've already mentioned, supplementing with omega-3 in the form of flaxseed, maintaining a vitamin D level in the protective range of 150 to 225 nanomoles per litre, regular exercise, and a particular style of meditation, mindfulness-based stress reduction meditation, such as advocated by John Kabat-Zinn at Harvard. And he went on to found the Overcoming MS charity and also the neuroepidemiology unit at Melbourne University. So George went on and started running retreats. He read this information, and happily for everybody here, he decided to share this and start running programs. And I was fortunate. I actually got a phone call when I was diagnosed with MS. One of the physicians at the hospital I worked at said, "Oh, look, you've got to read this book by this Australian doctor. I think it would give you a lot of hope." And I read it, and it made a lot of sense. But, you know, there's part of me that's sitting there going, well, if lifestyle change can be so effective, how come nobody's taught me this? I was an experienced doctor at the time, you know, member of the Royal College of Physicians, member of the Royal College of GPs. I've done my surgical exams, been through med school. How come no one's mentioned this? Or I remember doing neurology consults as a medical student, and if somebody was diagnosed with MS, it was a very difficult consult. You know, we don't understand what causes this disease. We don't have really any effective treatments. We don't really know how you're going to go. And that's not true. We've got an abundance of evidence. And so George ran these retreats, and I flew over to see him in January 2009. And during this retreat, you'd be taught about the evidence base for lifestyle interventions in MS. You'd be introduced to meditation, particularly mindfulness-based stress reduction meditation. I found one of the very useful interventions was looking at emotional health, emotional well-being, because most of us who've been diagnosed with MS were very distressed with the diagnosis. Most of us had lost our jobs. We were young adults in a very difficult space, and to be able to move from a very distressed state of mind to one where you felt like you had an understanding of the causes of the disease and what you could do to take control of it is a very empowering thing. And at the end of the retreat, you would make a commitment to yourself about how you were going to live, and then inform your friends and your family, maybe sending out an email to say, look, this is how I'm going to live now. This is the type of food I'm going to eat. If you come to my house, this is the type of food that you'll be presented with. If we go out for dinner, I'll need to go and eat at, places that will allow me to eat this way. And if I come to your house, this is the type of food that I'll eat. And the results, when you address the underlying causes of diseases, are absolutely stunning. And so here we are, 274 people with multiple sclerosis. And within a year of attending one of these programs, there is these dramatic improvements in mental health, physical health, and quality of life. And this just wasn't a one-off improvement. These are improvements that are sustained and maintained over the longer term, such that at 5 years, you maintain these dramatic improvements in health. And I'll just point out to everybody that if you look at drug studies, they all monitor people's progression. It's how much do the drugs slow your progression. This is the only study in the literature showing that people with MS can actually improve. So this is stunning results. And again, huge congratulations to George and the Overcoming MS team, because they've then gone on and done a massive study, the Holism study, 2,500 people with MS, 57 countries. And it just showed that all the pillars that George recommended in 1999, which are congruent with the pillars of lifestyle medicine, that when people live in this way, when they take care of their diet, their stress levels, exercise, avoiding unhealthy substances, you get this dramatic improvements in health. So supplementing with the flaxseed reduced relapse rates, consuming more healthy fats reduced relapse rates and improved quality of life, cutting out dairy resulted in a dramatic reduction in relapse rates, and exercising, improving quality of life, energy, physical and mental health measures, which are very, very severely affected in multiple sclerosis. The evidence on exercise is abundant. There's multiple studies showing that aerobic exercise improves memory, the HIIT training improving executive function. But the one study that I found really inspiring, this is one that I share with my patients with multiple sclerosis, is the effect of resistance training. So we know that as we age, we lose muscle mass. And instead of muscle just being this thing that moves the body around, it's actually a physiologically important organ that has effects throughout the whole of the body, producing over 650 myokines that are anti-inflammatory, anti-cancer, and importantly produce compounds that stimulate nerve growth, brain-derived neurotrophic factor. And this was a really great study. It was a randomized control trial from Denmark, where they got people to do progressive resistance training, so gradually increasing the amount of force that people were required to use. And this was supervised exercise. And they followed people up at 24 weeks and 48 weeks with MRI scans. And what they see is absolutely stunning. You're seeing neuroregeneration. So just to read from their study, they noted an increase in cortical thickness, and their conclusion was that progressive resistance training can induce an increase in cortical thickness, indicating that this has a neuroprotective or even neuroregenerative effect in relapsing, remitting multiple sclerosis. So the body's got this incredible capacity for healing if we give it the right circumstances. And I've sneaked in a non-MS study here, which I love, from the States. This was in people with mild cognitive impairment. So the majority of people with mild cognitive impairment, this is when you're having memory lapses, but you still have insight into it. But the majority, 70–80%, will go on to develop frank dementia. But resistance training 2 or 3 times a week restored normal cognition in 47% of people within 6 months. So this shows you that if you adopt these changes and you're meticulous in how you do it, it will have dramatic improvements very quickly. Just a few quick studies on lifestyle evidence in MS. We've talked about stress. One of the most convincing studies was a study done in the States, a 6-month randomized controlled trial showing that, so they had 2 groups. This is people with multiple sclerosis. Half the group were guided through mindfulness-based stress reduction meditation, and half the group did a generic relaxation exercise. And in the people who did the mindfulness-based stress reduction, there was a up to 30% reduction in the number of new lesions. So we're seeing a very significant disease-modifying effect there. Again, we've mentioned smoking before, but there's a dose-dependent response. And so that's very indicative of a very strong causative relationship. And we know that smoking increases the number of lesions, it increases your risk of disability, it doubles your risk of progression from a relapsing form of MS to a progressive form of MS, and quitting smoking can slow that progression. And we've already mentioned about the benefits of improving sleep. Lifestyle medicine in practice. Catherine, I'm really grateful you mentioned chronic kidney disease. I managed to forget that on this slide, but in my practice, it's great for reversing diabetes, blood pressure, metabolic syndrome, stabilizing or reversing coronary artery disease. I've had a really great result recently with a young lady with rheumatoid arthritis, typical presentation, inflamed joints, rheumatoid factor positive, inflammatory markers through the roof. She was meticulous about adopting the lifestyle changes. She's not on any medication. Her rheumatoid factor is now undetectable. I've had benefit with people with particularly Hashimoto's, but autoimmune thyroid disease. And there's some really great podcasts on the Physicians Committee for Responsible Medicine on that. But we know that lifestyle factors are strongly implicated in diet, particularly meat and dairy, in the development of thyroid autoantibodies. Again, there's a picture here, isn't there? It's the same thing, but inflammatory bowel disease. So Neil Barnard and Alan Desmond did a great case study, but perhaps the bigger work was done by Mitsuru Chiba's group in Japan. So Japan has seen an over 430% increase in the incidence of inflammatory bowel disease in the last 20 years, but they don't consider it a mystery. And they very helpfully write their papers in English and state that they regard the Western lifestyle, and in particular the Western diet, as the key mediator of inflammatory bowel disease. And if you present to them in Japan with mild to moderate inflammatory bowel disease, they might not even treat you with medication. They'll bring you into hospital, put you on a traditional Japanese diet, emphasizing whole food, plant-based nutrition, and people get better and they stay in remission over the long term. And yeah, helpful for mental health issues. And of course, we know Ornish's work for the treatment of prostate cancer, and we're now getting really good data in for improved outcomes after diagnosis of bowel and breast cancer. I thought I'd just throw this slide in. I love this. This is from Caudle Esselstyn's work showing the power of lifestyle medicine. So that's a very diseased coronary artery, and that's 2.5 years on a plant-based diet. And Rebecca, I've chucked in a couple of extra slides. Sorry, just as we were talking earlier, it made me think of it. So this, I love this. You know, this is the current state of Western medicine. I'd suggest that you've got the patient and the doctor mopping the floor, but the faucet's overflowing, and really we want to do is turn off that faucet. And one other study that I really thought I should have mentioned is the EPIC study. So this was a big study done in Europe, 23,000 people, followed them up with prospective studies where we can see the benefits of lifestyle change and 4 simple behaviors: not smoking, regular exercise, adopting a plant predominant diet, and maintaining a healthy BMI resulted in 93% less diabetes, 81% less heart attacks, 50% fewer strokes, and 35% fewer cancers. So yeah, it's really inspiring, and it makes medicine much more enjoyable when people get better. So thank you.
Thank you, Sam. That was fantastic. And I just find it so fascinating that there's one prescription, isn't there? There's one prescription. I mean, it's lifestyle medicine, it's a whole food, plant-based diet. Whereas if you've got medical conditions, it's one prescription for this, one prescription for that, and you end up with a whole bunch of things, a cocktail of medications, where this is just, yeah, one prescription for all. And I just want to make a comment too, though. You mentioned that the 20% saturated fat, which
20 grams, yeah.
20 grams of saturated fat in the diet. That is so easy to achieve that below that level on a whole food plant-based diet. If you're avoiding animal products, you're avoiding dairy, you're avoiding processed foods, just eating whole foods, it's much less than 20 grams saturated fat. So yeah, it's got to be beneficial for everyone. Now, let's have a look at a few questions that have come in, and we'll try and get through as many diseases as we can. We might run a little bit over today, but that's okay. Now, this is something that Stephan can probably answer, and I think, Catherine, you raised this as well. How do people keep their IBLM certification now that ASLM are not offering this recertification pathway?
So we were the nice people, and we allowed the Australians and the Brits to run their own MOC programs, maintenance certification programs. And obviously, now that they've moved from evidence-based to evidence-informed, we cannot possibly have them continue to maintain the MOC program, because if you have to read keto and paleo instructions, that's not really in the interest of lifestyle medicine and IBLM. And so we sent out numerous emails to all our diplomates and say, hey, if you want to maintain your certification with IBLM, you simply move your MOC from ASLM back to IBLM and you continue. But if you don't do this, then you simply work back to the 10-year cycle that most certifications fall under. So it's a 10-year certification regimen. But anybody who has missed those emails and wants to still move it from ASLM to IBLM, obviously I encourage you to do so. Basically, we gave the deadline of the 30th of March, and now it's May, but I'm sure we can be gracious about this, because we obviously want to be inclusive rather than exclusive.
Yeah, no, that's great. And it's so great that people can still have that process there. So now I've got a question around, we're talking about dose response quite a lot with lots of different things. Do you think that we obviously see it with diet, the closer you adhere to a whole food plant-based diet, the better response you'll have for whatever chronic health conditions you might have. But do you see that with the other pillars of lifestyle medicine too? Like the closer you adhere to those pillars, the better off you'll be. Sam or Catherine, maybe you could talk about it with your patients.
Catherine, would you like to go?
Yeah, as I said earlier, the pillars that I discuss the most with patients is sleep, and the one I put under happiness, stress management, emotional, mental wellness, and social connection. And absolutely, optimizing those areas has huge impacts, because they're often the drivers of the choices of the other health risk factors. And if you're looking at those drivers, then it makes it easier to adopt exercise, easier to adopt whole food plant-based and make the time for that. If you're looking at the stress factors in their lives, or why they're not sleeping well, and helping them to improve there. So yeah, definitely dose response. I guess I think of it as optimizing them. So what is the optimal, and let's see how far we can move people to reach those optimal levels.
Yeah, I guess we want people to adhere to the pillars as closely as possible, to be as well as possible. And like you said, do people gain energy? They're eating better, they're potentially losing weight, they've got energy to exercise and go ahead and do all those other things. So yeah, I think it's really important. And there are obviously a lot of barriers that people face with diet, and probably also lifestyle change as well. So we try and cover off with those on Doctors for Nutrition, just talking about it. And as a doctor, how do you help that? I mean, Sam, do you have patients and they just put up barriers straight away to making these lifestyle changes? How do you approach that in a sort of gentle way?
It's fine, because basically, sometimes it's not for everyone. I sort of have talks with people, and maybe they're not in the headspace to it. I think I approach it because any behavior change that's going to be successfully maintained is going to have to be self-directed, and then you're going to have to be supported in those changes. And so I think it's just to open up the possibility that you can feel well and you can be really well. And a lot of people are very motivated to not get really sick. So I guess MS people are highly motivated. It's often a disease of young adults, and people are pretty scared, and so they're generally fairly highly motivated.
Another comment.
With blood pressure, diabetes and things, and I think it's just raising an awareness of the health risks they're running. So if you say, well, there's this increased waist circumference, but what does that actually mean? Well, actually, you're at dramatically high risk of cancers, of heart disease, and all the complications that go with that, and often there'll be a family history of that. And I think if you just raise the awareness of the health risks that they're running, then there's a strong self-motivation to start making the changes. And then once you've sort of introduced that idea, that self-motivation, then it becomes a self-fulfilling thing, and they find the people who are going to support them, and obviously there'd be help with people that I'd put them in touch with, but then other organisations such as yourself and all, there's some really interesting people out there, aren't there? Really inspiring people who will help you, and it's actually really nice and good fun, and it's really nice to feel well.
Yeah, definitely. Catherine, did you have something you wanted to add?
Yeah, I was just going to say one technique I find really effective, and it got me hooked as well initially, is not to necessarily sell it as a lifestyle change forever, but hey, just try this. When you say about the dose response, just have a dose and see what you think, and let's follow up. And if you can get people to adopt some really significant dietary changes, in 2 or 3 weeks, their blood pressure can come down. Cholesterol will even change in 2 or 3 weeks. They sleep better, they feel better, and then with that biofeedback, it is a huge impetus for them to keep going. So, and often weight will drop in, and not necessarily the number on the scales, but definitely around their waists. It's one of the first things that changes. Waist circumference will shrink quite quickly, and that's really empowering and motivating for patients, because there's not many dietary changes that can happen so quickly. So I often use it as a technique if they're a little bit. I mean, in New Zealand, we're dealing with the whole dairy culture, which is so integral to our Kiwi psyche, and it's one of the things that I will use. Just try it. A couple of weeks, and then see how you find it, and often that is enough to get them over the line.
Yeah, that's really great advice. I think that just, that little bit of weight loss is such a motivation for somebody who's been so heavy and so tired, and, all the chronic health conditions. And also once people start noticing that they're losing weight, and, it's a good way of spreading that information. Oh, I'm on a whole food plant-based diet. Maybe you should do it too. Yeah, so it's always a good motivator. And, there's so much talk about the weight loss drugs, and I don't want to spend any time on them, but this is the healthiest way of losing weight, and you don't need to spend hundreds of dollars. So somebody's asked a question about osteoarthritis, and would that benefit from a whole food plant-based diet? And yes, it would. We've done a webinar on that in the past. There are studies that show the same, that it benefits like rheumatoid arthritis does. So that's great. Now, Sam, somebody is following the OMS program in Port Macquarie, and they've said, are you planning to have or run any retreats once you set up your clinic? And I'll put my hand up to come and give you a hand. It would be amazing.
I really want to do it. It's, as you know, I had a major battle getting this place open. But the building started, and that's the dream, to offer the clinic that I wish had existed when I got sick, and to offer the space. I think the retreat space, giving people a week immersed in that way of eating, a time when you can relax and just, eat well and feel healthy, and just allow that transformation to occur. That's the way to do these things, and that's the aim.
Yeah, and also that social support. I was fortunate enough to do one of the OMS retreats at the Gawler Foundation many years ago when I was diagnosed with MS, and it was life-changing, and I'm still in touch with the people that I met there many years ago. And yeah, that face-to-face, that's one pillar of lifestyle medicine, is that social support. And once you find the people that you want to associate with, it's really important. So it's great.
Connections on those, that's sort of, especially in those early years, when you're dealing with that illness, it's really nice to have peer support.
Yep. And there is no greater motivator for change than fear, although that's not sustaining. You can't keep that up. You can't keep it up forever, because that does disappear over time. Now, Stephan, somebody's asked a question about, do you have any sort of lifestyle medicine certification for people who don't have a PhD or master's? So I guess that's people who are not, they might be in the medical field somehow, but yeah.
Not certification, but that's kind of the comment I tried to make. So the education piece, anybody can get educated, and anybody can apply the principles in their own lives, and anybody can go and tell other people about the benefits of those 6 pillars of lifestyle medicine, and be familiar with the evidence, and therefore be an expert even though we're non-certified experts, because again, there is no licensure required anywhere on earth that I know of that prevents you from telling people, hey, eat more broccoli, eat more beans, go easy on your saturated fats. The key is actually the knowledge and the understanding, because there is so much misinformation out there. And again, what we have for sale is not popular in the pharmaceutical industry. It's not popular with the common medical environment. It's not even popular with the farmers. Because if you tell people, hey, and again, in the US, we always make the analogy, in the 50s, everybody smoked. And physicians and the government, everybody encouraged you to smoke. And all the farmers did was produce tobacco. But all of a sudden, we realized tobacco wasn't obviously the best thing in the world. Farmers started to stop growing tobacco, and they started to grow corn. And now we have too much corn, and we have to put high fructose corn syrup into absolutely everything from bread to milk to whatever. Anyway, the point I'm trying to make is people adjust. But obviously the battle is uphill. And so true knowledge is actually always worth having. And so I encourage people who, just because you can't get the IBLM certification over time, I know the American College is working on, there is the Board of Health and I think Health Coaching, H something or other. I think that can also be probably brought to Australia and possibly disseminated through Doctors for Nutrition. So again, you can offer people an alternative, because, and again, the physicians will agree with me, and we talked about it, behavior change is actually the most important thing we need to get to. So this is not just knowing the science and know what to prescribe, but getting people to change behavior. And that is a psychological thing that doesn't need an MD degree, right? So part of the certification in lifestyle medicine is actually the whole, how do we get people to change behaviors? How do we do motivational-based interviewing? How do we tickle out that why would I want to change and move that extrinsic motivator to an intrinsic motivator? And that is all out there. So it's not through the IBLM, but there is opportunities for you to get yourself upskilled, get yourself knowledgeable, and potentially over time, there will be programs for non-masters and PhD allied health professionals. Absolutely.
Yeah, and as demand will grow. And Doctors for
Absolutely.
We have a lot of resources, online courses and things like that.
There you go.
Yeah, so yeah, they can reach out anytime. All right, now I need to wrap this up. So thank you to our amazing speakers today. This has been a really great conversation. Thanks for all the insights and also personal stories that you've shared. They're really important for people to connect and find that it's relevant to them. So now in the coming days, everyone will receive an email with an evaluation survey. So it'd be great if you can complete that, and also a link to the recording. You can complete the evaluation now by scanning the QR code on your screen once that's up. And you will also post the evaluation survey in the chat box. So yeah, if you can fill that out, it just helps us improve. You can let us know what you might like to see in future webinars as well. Now, another exciting announcement that we have for everyone is DFM will soon be launching a new membership program. This will be your opportunity to join a movement that is advancing whole food plant-based nutrition as a powerful tool in disease prevention and care. Memberships are open to everyone. So talking about, including everyone, healthcare professionals, medical students, general community, everyone's welcome to join. And for a short time, there'll be an early bird discount as well. So make sure you're subscribed to our email list, and we'll let you know when the official launch of our membership program begins. Now, next month, DFN will be celebrating our 6th birthday. That time has gone fast. And during this time, we've done a lot, but we've got a lot more up our sleeves as well. So in honor of the anniversary, we'll be holding our own Plentiful Plates fundraising events with friends and family. This was a initiative designed to bring friends and family together, colleagues even, over a whole food plant-based meal. So while raising money for DFN. So if you'd like to hold your own shared meal to raise money, you can head to our webpage and find out more about hosting an event. So that's it for today. Thank you all for joining us, and we wish you all good health. Thanks, everyone.
Be well.
Okay.
Thank you.
Bye-bye.